Folbee is a combination of vitamins B6, B12, and folic acid. It is used for people who have a deficiency in these vitamins, which is important for good health. It is best to take Folbee as directed by your healthcare provider, usually once a day. It is important to take it at the same time each day to maintain consistent levels in your body. You can take Folbee by mouth with or without food, usually once daily as directed by your doctor. If you experience stomach upset, taking it with food may help. It's important to use this medication regularly to get the most benefit from it. Try to take it at the same time each day to help you remember. The dosage will depend on your medical condition and how you respond to the therapy. Some common side effects of Folbee include nausea, stomach upset, diarrhea, drowsiness, flushing, and numbness/tingling. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that if your doctor has prescribed this medication, they have determined that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, it's important to tell your doctor right away if you experience any serious side effects, such as mental/mood changes or unusual weakness. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed. As for the best time to take Folbee, it's important to follow your doctor's instructions and the dosage on the label. Be sure to take it regularly and at the same time each day for the best results. If you have any questions about the ideal dosage or timing, don't hesitate to consult your doctor or pharmacist for guidance. Before taking Folbee, it's important to talk to your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. Also, make sure to discuss your medical history, especially if you have certain blood disorders. It's important to note that Folbee may cause drowsiness, and using alcohol or marijuana can increase this effect. It's best to avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. It's also important to limit alcoholic beverages and talk to your doctor if you are using marijuana. If you are pregnant, Folbee should only be used when clearly needed, so make sure to discuss the risks and benefits with your doctor. Additionally, if you are breastfeeding, consult your doctor before taking Folbee. When taking Folbee, it's important to be aware of potential drug interactions that could affect how your medications work or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Folbee include altretamine, cisplatin, levodopa, when used without carbidopa, folic acid antagonists, such as methotrexate, and hydantoins, such as phenytoin, diphenylhydantoin, pyrimethamine. It's also important to note that Folbee may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are using Folbee. As for the optimal timing and dosage of Folbee, it is best to follow the instructions provided by your healthcare provider. Typically, Folbee is taken once daily, and the dosage will depend on your specific medical condition. Be sure to discuss the best time to take this medication with your doctor. If someone has taken too much Folbee and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. You can call 911 or your local poison control center for assistance. In the U.S., you can reach the Poison Control Center at 1-800-222-1222, and in Canada, you can call your provincial poison control center. It's important not to share Folbee with others. While taking this medication, your doctor may recommend lab or medical tests to monitor your progress. It's best to get your vitamins and minerals from healthy foods, such as leafy greens, other vegetables, and citrus fruits. Folic acid is also found in enriched grains like bread, pasta, and cereal. Some brands of Folbee may also contain additional ingredients, so it's important to consult your doctor or pharmacist if you have any questions. Maintaining a well-balanced diet and following dietary guidelines from your doctor is also important. If you forget to take a dose of Folbee, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at the usual time. Don't take a double dose to make up for the missed one. It's important to store Folbee at room temperature, away from light and moisture. Make sure to keep it in a safe place, away from children and pets. When it expires or is no longer needed, be sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for the best way to do this. And remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.